Well, good morning, everyone, and welcome to a joint Health and Human Services and Education and Culture Committee meeting. Today, our subject is early care and education and the ECEI initiative update that we'll be receiving from our Department of Health and Human Services along with our Montgomery County Public Schools. It was back a few years ago when it was then Council President Navarro had been focused on early care and education, something in which she's spent her lifetime on and focusing on, especially in her professional career outside of elected office. And certainly something where all of us on this council remain incredibly passionate about the work that needs to happen. And what we see just in federal supports that is a part of the Build Back Better initiative and many other folks that are now saying that this is the linchpin to addressing the education equity opportunity gaps that continue to exist that have been exacerbated by COVID. So it's really great that we actually started this work well ahead of some of the challenges that we saw that befell us by not being in-person learning with our school system over the COVID pandemic. It really is great to know that pre-Kerwin and pre the blueprint that we were already working on some of these initiatives as well that were solidified at the state level in terms of the things that we need to do to continue to push for a more robust support mechanism that's there for all of our kids, especially from birth to 5. And so what I'd like to do is acknowledge my co-chair, Chair Albornoz and Vice President Albornoz for all of his great work in continuing to support this initiative as well. He, Council Member Navarro, and I have worked on something, but that's not the topic of discussion today. What we're going to talk about is this 4-year action plan that was designed to specifically expand early care and education opportunities in Montgomery County for our young people. And so, especially when it comes to our infants and toddlers and preschoolers. So with that, let me turn it over to Councilmember Navarro, who led this effort, again, when she was council president. And then I want to turn it over to my co-chair, Chair Albornoz, for any opening remarks, and then we'll go ahead and turn to our panel. So Councilmember Navarro.
Good morning, and it's thank you so much, Chairman Rice and Chairman Albornoz and my colleagues, as well as staff who's been working on this issue for quite a while. Every time I have an opportunity to talk about early care and education, I have to reflect on what I believe continues to be a point of contention in our country, which is who is responsible for quality early care and education. And for the most part, we have continued to see that there is the sense that it's the parent's responsibility, period, versus thinking of early care and education as a continuum of our education system writ large. And until we get to that point where we begin to own and therefore fund quality early care and education, we are going to continue to have this patchwork of efforts and also patchwork of results, where we see that the most impacted continue to be our Black and Brown children. And every time I think of what our census continues to show us, which is that in our country, we have an aging population, but also a young population. And when you look at who are these young people coming through and these babies that are coming through, they're predominantly Black and Brown. And so this notion of how do we prepare our workforce, it's rooted in early care and education. And back in the day when I was growing Centro Familia to promote precisely early care and education in the immigrant community, I happened to attend a conference in New York, and I shared a cab with this amazing woman who was the president of the AFT, Federal Teachers Union. And I'll never forget how, when she asked me what I did and I explained, what I was doing, et cetera. And she said, one of the reasons that we have not been able to really move forward with this kind of like a robust initiative nationwide is because of efforts like yours. And I was like, what are you talking about? This is so rude. And she explained that because we continue to address early care and education in a very sort of minor, not scalable, initiatives, but just this piecemeal, very small efforts, that's why we continue to see a very, very anemic impact nationally. And so I understood where she was coming from, and I never forgot that, because I always kept thinking about scalability, how do we get there? So I say all of that because this has not been something that we came up with overnight. This has been a very important incremental approach in the county. And this 4-year action plan, I felt strongly was needed to jumpstart early care and education in the county. For a while, we had been pretty active in this space, and then there was kind of a lull. So this 4-year plan, the goal was to have metrics and also to check all the boxes. So we wanted to ensure that we could expand the availability with family child care providers, with private centers, with nonprofit centers, evaluating, even commercial space to see if we could use that, our own public facilities to see where we could accommodate childcare space in order to expand that as well. We looked at issues around subsidies, not just for the ones that needed the most, but also, middle class families, because childcare is so expensive. And so there was just this very robust, training, technical assistance, this very robust approach to jumpstart this initiative, and for this to be the beginning of a next level. As you said, Council Chairman Rice, lo and behold, this was 2019. We had no idea what we would be facing in 2020. And so once again, we were ahead of this wave. And when the pandemic hit, obviously this particular industry got hit really hard. But I'm glad that we already had the pieces in place, and I'm glad that the administration continued to work. But we're not out of the woods. There's a lot of anxiety. I was just having conversations this weekend with some, family child care providers who are really concerned and worried about the sustainability and how that affects our families, our parents who are also trying to figure out how to get back into the economy and jobs. So this is full circle in many ways. And as you said, we will have a conversation about Bill 4221 to designate an early care and education coordinating entity, a private public entity, which is the last piece of this entire journey. And I feel really, really gratified with what we have been able to put in place. And I hope that we are then very well positioned for whatever comes down our way through the state and through the federal government to take advantage and position the county where it needs to be. So all of that to say that this has been a very long journey, but I think a very productive one. And lastly, I will give a shout out of all of my colleagues that were commissioners under the Obama administration, the White House Commission on Educational Excellence for Hispanics, because this was a really important focus, and I feel like it really helped me learn and also share with many who were leading around the country on this issue. And a lot of these ideas about incorporating the private sector, about having a designated funding stream, and also this governance structure, this private-public governance structure, those were 3 things that were front and center, and the reframing of the importance of early care and education, not just as a moral issue and not just as an educational issue, but also as an economic imperative. All of that really grew out of my experience during my time as a White House commissioner. And I am just so grateful to everyone who continues to work in this space and continues to move the ball forward. So thank you so much. It is really wonderful. And thank you to all the staff, because they're the ones who have taken charge and have continued to achieve our goals even through the pandemic. Thank you.
Well, thank you very much, Councilmember Navarro. Let me turn to Chair Albert Knopes.
Thank you, Mr. Chair. I'll be brief, but this initiative was important 4 years ago when it was led by our colleague and friend, Councilmember Navarro, but it's never been more important than it is right now. And we couldn't have predicted then that we'd be in the middle of a global pandemic that has seen tens of thousands of our workers here in Montgomery County have to leave professions because of childcare challenges that are very real and raw, and that all of us have some degree of experience with at this point. And let me just say, sidebar, when the dust settles, when you think about it, Councilmember Navarro's turn as president is going to go down as one of the most consequential that we've had in a long time here in this county because of this and many other efforts that she spearheaded and led. So I really want to also acknowledge the great work that's been done to get us to this point, certainly some heavy lifting, and where we've been able to achieve the benchmarks that were set forward, and in some cases have actually been able to surpass them. So it did lay the groundwork perfectly for this next phase of this initiative, which we will be talking about in a joint session later on. But I look forward to hearing more about the great progress that has been made, and commend our colleagues in the executive branch, in our nonprofit sector, and in the community for working collaboratively to get us where we are right now, which is in a good place. Thank you.
Well, thank you very much. And so I'm going to turn to our guests, but I really want to thank Ms. Yao for, again, a very thorough packet, for getting everything organized for us in a way in which makes it very easy to follow, and for getting us the presentations, all of those kinds of things. I did just want to highlight that this plan that is really important, that again was spearheaded by Councilmember Navarro, focused on 5 different things, and it was expanding the availability of ECE seats, increasing access to quality ECE through using the WPA, promoting the sustainability of existing family and center-based programs, something that, again, you heard from Councilmember Navarro is incredibly important. We need to continue to lift up and stand those up because they are the core and lifeblood of our early care and education industry. Ensuring that cross-agency collaboration is there. That is this new sort of entity that Councilmember Navarro and Vice President Albornoz and I are collaborating, and the entire council are collaborating on. And then monitoring and aligning the efforts with Kerwin and the recommendations for a blueprint for Maryland's future. So all of those things are all encompassed in this plan in terms of what it is that we need to do to take ECEI to the next level. So with that, I want to welcome our guests. We have Dr. Raymond Kroll, who is our director of our Department of Health and Human Services, Ms. Joanne Barnes, who actually led Children, Youth, and Family Services, but is now a contractor with DHHS, Ms. Bibi Otero, Special Assistant to the County Executive. Welcome, Bibi. I wasn't sure if you were going to be here, so I'm very happy that you're here with us. We've got Ms. Rochelle Rubin, who is our Chief of Teaching, Learning, and Schools for MCPS, our Montgomery County Public Schools, Ms. Nichelle Owens, who is the Acting Director of our Division of Early Childhood, Title I Programs and Recovery Programs, and then Dr. Sonia Rueda Hernandez, who is the college-wide Senior Director of our Chair of our Early Childhood Education programs for Montgomery College. I know that we also have Barbara Andrews, who's Administrator, Dr. Barbara Andrews, excuse me, our Administrator for Early Childhood Services, and Jennifer Arnaiz, who is the Director of Montgomery County Child Care Resource and Referral Center, who is with us as well. So I know we have a presentation. Let me turn it over to you, Vivian, to walk us through who's going to be first. And I would ask my colleagues to just text me with, if you do have questions. We will wait until the end of the presentation and then be able to enter into a dialogue, discussion, and questions at that point. So Ms. Yao, turn it over to you.
I believe Dr. Kroll is going to kick it off, but I'm going to punt it to the folks who have they've coordinated this presentation. I also did want to mention that there will be a joint committee discussion on the implementation of the blueprint for Maryland's future after recess too. So there will be a more in-depth discussion about that at a later time as well. So,
Dr. Kroll.
Good morning, everyone.
Good morning, sir.
Happy to see you all again. And happy Thanksgiving to all of you in advance of the holiday. Let me just, Vivian, are you all going to do the run the PowerPoint from your side?
I was thinking that you guys would be sharing screen, but let me pull it up.
Okay, I just want to know, we can we can do it from this side. I think I believe either Joanne or Barbara have it and can pull it up for us if we need to. But I just want to make sure. Oh, while we're sorting that out, just want to say that that this initiative is one that is always is never far from off my radar. At any given point, there's always something going on with this initiative. It has been a delight to watch this and to work through this and to work with the partners and the staff who've been working on this for the last several years. This was I think probably Councilmember Navarro will be a signature of your of not only of your time as president, but one of your time as on council as we go forward and look forward into the future. And I know that you and the county executive were very much in alignment at the outset of this, and the county executive is still very much supportive of making sure that we have adequate child care for our children. I am, as a psychologist, I'm very much mindful of what this means developmentally. These are crucial years for children in their development, and everything that we can do to make that a learning opportunity and an opportunity for successful bonding and partnering and social development for children, we ought to be about the business of. So, and you're right, too long it's been left, I think, to families to figure this out for themselves. And not that they cannot do that job, but I think it is important for us to be able to help every way we can. I'm also, like the rest of you, watching with interest and hope the work of Congress on building on the Build Back Better Act, and hopefully we'll get some growth in the childcare industry and some development in childcare out of that. If we can switch to next slide. I wanted to spend a moment just to say thank you and to acknowledge the partnership and the collaboration that has been in play throughout this process. The staff of HHS have been enormously energetic and energized by this effort and very focused on making it reality, along with our staff over in the Office of the County Attorneys and in the Office of the County Executive's Office, but especially want to acknowledge the partnership with Montgomery College, the school systems, Montgomery Moving Forward, and it has, and of course the County Council and County Council staff, but also to our partners that we've consulted with, the Early Care and Education Council, the Commission on Child Care, MSDE, obviously, and many others that I won't take the time to name here, but you can see as we've outlined on the slide. Next, please. So, Council Chair Rice has already acknowledged. I should say Chairman Rice has already acknowledged the 5 priorities of the ECEI, and this presentation will flow through each one of those in turn. So, if we can do next, please. So first, beginning with sustainability, obviously. Next up, and this is really all about the state of childcare in the pandemic, and we have all been all of this is about recovery and our efforts in recovery across the entire life of the pandemic, and the struggles that we've had. At present, 98% of all of the license programs in the county have reopened, and there are about 2% that have not sent reopening forms to MSDE, and we at this point don't know their status, but we are happy to say that most of the providers have reopened. We do know that sadly we lost the 19 centers and 75 family child care homes gave up their licenses and closed permanently. None of those family child care centers were ones that we've recruited during the ECE, so there's some benefit to ECE showing up even in the midst of closure of the pandemic. Throughout this pandemic, we have, as part of the recovery effort, we've allocated and provided over $20 million in funding, from everything from PPE and supplies to tuition supports to full day supports and supplemental tuition, as well as relief to providers over the county over the life of the pandemic. It has been a tour de force and an incredible partnership with our providers and with those folks who have helped us to get places back open and keep them open throughout this pandemic. So I'm not going to go too much more into detail on this, except to say that we have done a lot of work in terms of providing information to families and communities. I'll go back into some of that in a little bit later. But for now, I want to turn this over to Dr. Hernandez to talk a little bit about the successes of our students in this process. So Dr. Hernandez, over to you.
Thank you so much. So I'm going to talk a little bit about Montgomery College and our partnership with what we call the ECEI, and we call it the ECEI Early Care and Education Initiative Scholarship. So there have been many student successes. I want to give some actual real data. You see that spring we graduated 22 students. Those are specifically students that were going towards degrees. This was not all the students in early childhood education. We had over 60 early childhood graduates. They are on scholarships, financial aid. The ECEI, though, has been critical for those really focused on childcare that may not qualify for the financial aid or other scholarship opportunities. And to give you an actual reality of what happens in the United States nationally, the actual graduates may only be 8 per year. So when Montgomery College is saying that we are graduating 60 and we are anticipating another 50 to 60 graduate this academic year, we have had national organizations turning to us and asking what we are doing. So the student successes is the actual support system and putting the program online so students could actually take courses without having to come to campus, because it is so difficult to be working in childcare and then come to a college campus. I do want to let you know that we have been doing this since prior to COVID. Dr. Pollard, once we hit COVID, Dr. Pollard actually used Montgomery College early childhood programs as a model of what we were doing. The virtual settings and classes, we were already doing that online to better support our early childhood educators. So those are all student successes, student completion. We've really focused on what can we do to support and have them complete, whether it's a certificate or a degree. We really want them on a pathway. And we've created one from our non-credit side, regardless of where they are entering and what their actual goal is to exit. So in spring, we graduated 22. That is without the CDA or the credit for prior knowledge. The college does and approved. If a student completes the CDA, they receive 6 college credits at no cost to them. So the CDA, we did give in the spring 15 credits, or 15 students, 6 credits each for credit for prior knowledge. In summer 2, we graduated 5. And then in the fall, in December, we are anticipating that 11 will be graduating. Currently, because of the pandemic and because of a delay with the CDA, we don't have the numbers of how many will complete the CDA. Many are waiting for observations. So next slide. So the MC Early Care and Education Initiative, the students can come in, as we said, at any entry and exit point. Students begin on our non-credit side, and this also includes ESL. What we have found is critical is that many of our students do not, in childcare, do not place into English level. Even native students that graduated from high school here, they may end up placing into developmental English classes. So we wanted to be sure that ESL classes and developmental courses were included. So these are the total numbers for the fall. We did have 22 disapprovals this fall, and that was due to them not being eligible for credentialing. Credentialing is a requirement. And so the 22 that were disapproved, 20 were specifically because of that requirement, that we had to tell them, no, we are sorry, you're not part of credentialing, we have to disapprove. 2 left childcare, and what that means is that they had been laid off from work and they needed to provide for their families. So they found whatever job they could to continue to support. We are anticipating now that everything is back and running, that they return to childcare. This morning, we were actually meeting with 3 at 7 in the morning to support them to continue in the spring. With the current enrollment, you will see that during the pandemic, we had about 196. 22 of those graduated, 5 then graduated in the fall, so that's a total of 27. So the enrollment went down a little bit, and the decrease is due to, we don't say there's really a decrease. Students take a break. They have been going consistently to classes throughout the pandemic. And so when the fall hit, many of them wanted a break and said they would return in the spring semester. So we are in constant contact with them. So although it says that our enrollment decreased, those students are still there. We're just not counting them as part of our registration because they did not register for classes this fall. So we wanted actual numbers. These are the total of 110 are registered for classes. 22 were disapproved for this fall, and we have open enrollment. We are continuing. We have students registered for winter, and we have spring registration going, and many students already registering for the spring, meeting with academic advisors. So any questions?
Well, I think we'll wait until the end of the presentation before we do that.
Okay, then we'll continue on. And our second area, priority area, is access and affordability. It doesn't help us if we've got access, if we've got seats available, but people don't know how to find them and don't know and can't afford them. So for this piece, I'm going to ask Ms. Barnes to come in and start to talk about our WPA program and subsidies. Give me an update on that.
Good morning. As already mentioned this morning, the impact of the COVID pandemic has been profound in this area, and that holds true for the subsidy programs. In spite of the programs that we've made available to support both families and providers, much depended on the trust of parents to be willing to move their children back to congregate care, even as they were returning to work. But we've taken advantage of this time not only to find ways to support them, but also to continue looking across the country at different models and ways to improve our subsidy process. So this slide just shows a brief update of some of the things we have been looking at to improve the program and the impact it has for families. We are currently looking at different models across the country to develop a pilot with providers in certain zip codes by contracting subsidy seats directly to the provider. This is something we've seen that has been successful in other jurisdictions, including the district. So we're looking forward to implementing a pilot in that area this year. The director of HHS, Dr. Crowell, has approved us the ability through a waiver to begin offering subsidies to children in Montgomery County, regardless of their status, beginning July 1, 2022. Why is it taking us so long to put that in place? There are several steps we have to go through in order to meet the, clarify the eligibility requirements and make sure that we can get the word out to families, as well as to do some technology changes to be able to accommodate that. But our plan is that where the program now serves children who are citizens regardless of the status of their parents, now we will also serve children who live in Montgomery County regardless of their status. The next big thing that we've been working on is an increase of the income limit for the WPA program. Effective November 1st, we increased that limit to 425% of FPL. We were reluctant to go up on the income initially because we wanted to spend our efforts moving to enroll more children in the lower income brackets. We will continue to do that, but by increasing it to 425%, it helps align it with our standards that have been established by the Community Action Foundation in terms of what it takes to live in Montgomery County. And also, it may put us a little ahead but our goal is that these income guidelines will stay in place and be updated every 3 years. So we felt it was important not to be too conservative. The last thing that we did is increase our subsidy rate tables. Previously, they ranged from 65% to 80% of the average market rate, and we've increased them now. They range from 85 to 100% of the state market rate. And we know that the average market rate still pales as compared to the actual cost of care for providers, but we're definitely moving in that direction. The right side of the slide shows a couple of scenarios for families at different income levels, 180%, 270, and 340% of FPL. And it shows you for different children what their old rate would be before these changes and what their new rate is now, acknowledging what it takes to provide high quality care for children. These rates are moving in the right direction. And we can go to the next slide.
So the next piece of this is just about the fact that once it's affordable, we still have to help folks to find the services and navigate the services. So for us, this is a special nod to the communication shop for the fantastic work that they have been doing in making sure that folks know how to find it and how to pay for it. They've done work on multimedia events, both on Facebook and social media messaging for families, both in English and in Spanish, to help the community to find the supports that are available and to figure out how they're going to get paid, how those services can get paid for. And we've also, just because it can't all be about messaging and social media messaging, there's a new family resource specialist position that's been created to support families who are looking for childcare and to help navigate the subsidy process and identify other resources that they may need as well. Next slide, please. So we're shifting over to alignment as our third priority area and the collaborative areas efforts. And if you can skip to the next slide, that'd be fine. And this is just our ongoing effort to work with partners and providers, partners beyond HHS and beyond the childcare industry to make sure that we have collectively the resources we need in place for families and for providers. So we have on the rent relief space, we have, for example, spent about $700,000 in rent relief for childcare in public spaces, basically absorbing the cost of the rent in public spaces during this pandemic and as part of the recovery effort. We've also coordinated with Office of Emergency Management and Homeland Security to identify what PPE was needed for our providers and to make sure that they had PPE for masks and sanitizer and cleaning, so that we were able to get them what they needed. We've also partnered with permitting services in covering the cost of permitting fees for newly recruited family child care providers. And so those collaborations are just kind of the tip of the iceberg of the ongoing work that we've done, both in terms of with partners around the county to make sure that we can keep our systems, our child care providers open and keep it growing. So we can transition to the next priority area. Priority area 4, and expanding availability of ECE seats for infants, toddlers, and preschoolers. And for this, I think I want to turn this over to my colleagues over at MCPS, Ms. Rubin and Ms. Owens, to talk a little bit about the work that MCPS has been doing on this front.
Thank you, Dr. Crowell. Good morning, Chairman Rice and members of County Council. We are here today, this morning, to provide an update on MCPS's role in expanding early childhood seats and meeting the cognitive, physical, and social emotional needs of our pre-kindergarten students. Since March of 2020, as you can imagine, and as you've already heard my colleagues mention here, it has been quite challenging with the adjustments we've had to make as a result of the impact of the COVID-19 pandemic. We have, however, continued to enroll eligible 3- and 4-year-olds into our programs on a consistent basis. MCPS, continues to collaborate with our partners in the Department of Health and Human Services to increase access to high quality early care and education. A diverse group of stakeholders meet regularly to focus on workforce development, affordable child care, technical partnership with private providers, and Head Start programming, of course. Additional collaboration occurs with the Early Childhood Coordinating Council, the Commission on Child Care, the Children's Opportunity Fund, and Montgomery Moving Forward, all that ensures that MCPS does share one voice with the early care and education community. So at this time, I'm going to pass it along to Ms. Nichelle Owens, who is going to provide you some details for how MCPS has expanded access for our youngest learners. Nichelle?
Good morning, everyone, and thank you, Ms. Rubin. MCPS is a central part to the mixed delivery system, considering the education aspect of early care and education system. And we're just one part of the broader early childhood partnership and community. This is really a team effort for us, and it requires input from all stakeholders to support school readiness for our children and for our families. To that end, the commitment to expansion of pre-K programs continues in this school year in FY22. As you can see on the slide, MCPS has increased access to locally funded pre-K programs to families up to 300% of our federal poverty level and our locally funded pre-K classes. We also increased access to one of our two-way immersion programs, which is located at Washington Grove Elementary School. We went from 20 seats available to 40 seats, now providing more enrichment to our students. You will also note that during summer of 21, that MCPS had a robust summer program, and it didn't just start at kindergarten. We, of course, included our pre-kindergarten students as they transitioned into the kindergarten space. So as you again see on the slide, we had 175 rising kindergarten students participating in our pre-K summer programming. We also averaged about 1,012 rising kindergarten students participating in our Title I ELO sales summer program. And we continue to plan for next year's summer and include our pre-K students. You also see that we have enrollment data listed on that slide. It's fine, it's fine. We can go to the next slide, thank you. Another part of our work includes our commitment to our early childhood centers and the Family Involvement Center. We continue to maintain the Up County Early Childhood Center, which is currently, and the Family Involvement Center, which are currently housed at Emory Grove in Gaithersburg. That is their temporary location because they are about to make room for South Lake Elementary School, which will be going into the Emory Grove site. And therefore, the Up County Early Childhood Center will be transitioning over to Watkins Mill High School. They have a dedicated space there, which we walked through and started engaging in some deep planning around it. Eventually, we anticipate that there will be a move to a dedicated space at Watkins Mill High School on their grounds, and it will be separate. And so our interim superintendent has made a recommendation to the Board of Education for additional funds for the next 3 years to support that effort. We continue to fund our McDonald Knowles Center as well. And we have also been discussing some of the requirements, the new certification requirements that are included in the blueprint to ensure that we have continued staffing. We do anticipate that that will require a lot of coordination within our organization. Our enrollment for this year has increased over last year. And we've also had the benefit of converting 32 of our Head Start classes, 32 of our Head Start seats not classes, seats, from part day to full day. And then we've converted 40 pre-K seats to full day. Another significant part of our work is engaging our community partners. We have 8 community-based partners, and we do meet with them regularly and also offer professional learning opportunities to their staff. With that said, I will hand it back to Dr. Crowell. Thank you.
Okay, thank you, MCPS and Ms. Owens and Ms. Rubens. Continuing on in terms of expansion, the Early Childhood Center, both as a partner and as an effort to expand, went virtual during the pandemic, just as a way, in terms of expanding access, rather than just shut down and be done. They switched over to virtual, and it has been a remarkable success story. Those virtual sessions, those live interactive sessions with families across the county have been incredible. Virtual circle times that include singing and music and movement, story time and arts and activities. And I have to say, just to date myself and at the risk of minimizing the work that they have done, it reminded me of Romper Room. For those of you who remember Romper Room, and are old enough to remember that whole series of activities for young children. It was alive and well and updated for 2021 and in the face of a pandemic. They also continue with newsletters and information about activities and resources for children throughout this pandemic. They are now in the process of reopening their sites, with Rockville opening 2 days a week. I believe they've opened for 2 days a week, Tuesdays and Thursdays at this point. And in Gaithersburg, that's scheduled to reopen. It's scheduled to reopen in Germantown. Small groups with a lot of precautions, because we are still talking about a group of our residents who are unvaccinated at this point, and we are still in the middle of we're not out of a pandemic yet, but they are reopening and trying to make sure that they've got some capacity. Next slide, please. And then the other piece of this is our GoFCC, growing opportunities for family child care and growing our recruitment effort. This is at this point there are 113 registered FCC homes, representing an additional 869 seats. The average enrollment is still small due to COVID impact, but 15 of them have been approved as EPCC programs, and 23 have received county COVID recovery grant funding. They are, when you look at our map in this, the red dots on the map illustrates providers that are recruited in targeted zip codes that were in key zip codes that are identified, and the blue dots are in all of the areas across the county where we have been able to register and recruit new providers. As a note on this, it is important to note that I just want to acknowledge and recognize that the state has adopted our model for a state initiative that they want to launch in 2022 in additional areas. Is a state part of their statewide effort to increase FCC beds seats across the entire state. So I'm hoping that you all and along with our team will take that as a point of pride, that once again the county is a model and is leading the way on this effort. So we shift over to the next slide then. Just continuing to work on expansion of seats in a variety of different places. Wheaton Child Care, collaboration with National Parks and Planning. We're planning to put out an RFP early next year that will strengthen our child care efforts in Wheaton. We are also participating in the Homegrown grant. It's a federal initiative that is we're one of 6 states chosen to participate in this 2-phase initiative that will look both at regulated and family friend and neighbor child care, and then develop hopefully an action plan. Well, not hopefully, to develop an action plan to address the quality and licensure and sustainability of home-based child care. We are doing Three's Aging Out of Head Start, and we continue to do research, development, and data collection throughout this initiative. So next, please. Of course, I don't need to spend a lot of time on this, on Area 5. Next slide, please. Yes. That the Blueprint Commission report is completed. It's completed in October this year. And we supported the hiring of a Blueprint coordinator to make sure that we can actually do implementation of the Blueprint. And the ECEI continues to serve as a steering committee as the Early Childhood Advisory Committee for the Blueprint. And then lastly, to talk a little bit about budget. You've got the budget piece in front of us here, and I think, Joanne, are you coming up to talk about budget for us here?
I wasn't planning to, Barbara.
Barbara, okay.
Good morning, everyone. I will do my best on this. This is the first quarter, so we're still in planning stages with much of the budget. During the pandemic, we had to shift a lot of our work and our funding to all of the funding pieces that you saw earlier on pandemic relief. One thing I do want to make clear is that when we're missing, no, we're not. When you put these into buckets, I always say it's a little bit like the SATs, it's picking the best right answer. So a lot of the pieces that are in access and affordability are also expansion projects. It's not that there's a lot less money in expansion. So for instance, when we're working on threes who age out of early Head Start and finding seats in childcare programs, that's both access and affordability, and it's also are there other things you want me to highlight, Raymond? This is the way we look at our budget broadly. It's the different buckets of the priorities of the initiative. I'm trying to pull up my notes. I think I've said most of what we needed to say.
Okay, I think that's fine. So I just want to say thank you to you all, and we can stop sharing with that, and we are ready for any kinds of questions, and hopefully we'll have some answers for you.
Well, thank you very much to the entire team for your presentation, but also for the work that went into making those numbers appear on paper, and for all the great things and accomplishments that we've been able to put forth. I have a number of my colleagues who have already asked, and for any of my other colleagues who haven't, just please text me so that I can add you to the list. Mine is not necessarily a question, but more just a comment. And it is along the lines of what we just closed on, which is budgetarily. We are going to have money that is going to be coming to us via Build Back Better. This council remains committed, as the county executive is, to continuing to fund ECEI initiatives because we know how important they are. Part of the challenge has always been with our large entities like HHS and MCPS actually moving quickly to be able to stand up these programs that we know are supported. We fund them, but whether it's hiring, whether it's actually creating the program itself, those things take time, and we understand that. The challenge is, unfortunately, that especially when it comes to ARPA funds and other kinds of federal funds, we need to expend those as quickly as possible and don't want to have those funds sitting and not being utilized to the fullest extent practicable. And we want to build off of those initiatives that are already there so that we can even further accelerate the progress that we're looking forward to make when it comes to early care and education initiative opportunities. So from that standpoint, it's tough because I know it's not easy to do and to try and stand up these initiatives and programs. It's always been a challenge for us. But I hope that during this time frame, we've been able to see, because I know that we've accelerated some much more quickly than we have in the past. And we can build off of that and make sure that we have the ability to do the same thing again, because I anticipate there's a lot of money coming down from the federal government via Build Back Better. There's a lot of focus at the state level that's on these initiatives as well. And so from that standpoint, I want us to be prepared. And I think that where we were in terms of Councilmember Navarro's initiatives to get us started and to build this framework. I just want to make sure that the framework is sturdy enough and expansive enough to really cover the needs that we're seeing in our community. And so I'll just leave it there. It's just something where, again, I know that it's not easy. You're talking about big departments and big entities in both MCPS and DHHS. But we are going to have to really challenge ourselves to moving a little bit more nimbly to respond to a lot of these challenges that we see are befalling our families and our young children. So with that, let me turn to Councilmember Jawando. I've got Councilmember Jawando, followed by Councilmember Navarro. Anyone else who'd like to be added to the list? And I've got Chair Albornoz as well. So let me start with Councilmember Jawando.
Thank you. Thank you, Chair Rice, and to the entire team here. Really appreciate all the efforts. And to my colleagues, this is it's an exciting time in early childhood to be on the precipice, hopefully, of some dramatic expansion. I know while not the subject of this meeting today, as Councilmember Rice mentioned, Chair Rice mentioned, we do have these, kind of hopefully these looming. We've got Build Back Better looming. We've got the state work, as we've talked about. And I do think, to Councilmember Navarro's point, we're going to be in a good position because of the work we've done and that she's led, and that we started off. I think it was one of the first big press conference events we did when we back in 2019 when we launched the 4-year plan. So I guess I want to, if you want to offer, if anyone wants to offer comments on how you see us best positioned to leverage a dramatic expansion. I think Councilmember Rice was getting to this a little bit in his comments. I'd like to hear that kind of just broadly from maybe Dr. Kroll or whoever is, or MCPS or both. And what do you see as the opportunities and the challenges, and just kind of a foreshadowing of things we need to be thinking about as we head hopefully towards some dramatic expansion? You're on mute, Dr. Kroll.
Of course I am. So I think I'm going to, I'll start off, but I'm going to invite Bibi to weigh in on this as someone who has spent a lot of time and energy working on this over the last couple of years. But I would say this, that since 2019, we have been building and working on this process. And of course, COVID interfered, but COVID did one thing for us. It showed us how quickly we can move and the ability of county government to move quickly in the midst of COVID. And so that resource and that skill set doesn't go away with the end of the pandemic. We still have that ability to move. So as federal funds come down the pike, I see it as an opportunity to expand on what we've already put in place in terms of funding and support, and to build more quickly to open up more resources, and especially around the expansion of providers and beds. The limiting factor will only be, are there enough folks who are interested in coming online and joining the party, I think. Right. So, Bibi, can I turn it over to you for any other insights you might have?
Sure thing. Thank you very much for having us and for your continued interest in early care and education. As you well know, it's one of my loves, so I'm always very excited that folks are interested. But a couple of things. I would say I've been doing a lot of work at the national level on the Build Back Better, and as some of you may know, was co-chaired President Biden's early childhood policy team in last summer. And so I'm very pleased to say that the Build Back Better, in fact, takes in a lot of if not all of the recommendations, as well as the dollar recommendations that his policy team put forth. Much of Build Back Better, as you well know, is coming through the states. And so it's going to be very important for us to be positioned for the states to be able to work with our providers, and so helping our providers be prepared for that. Most of the dollars will go, whether they are child care or pre-K dollars, will go from the state to, in the case of pre-K, to the school system and to individual providers as well as the child care pieces. We could have a whole other session on what Build Back Better does, and I'm happy at some point if anybody is interested in laying out a little bit more once it comes out, how localities will work compared to how states will within the context of Build Back Better. But the large portion of dollars will go to the states unless a state chooses not to take the dollars. And if the state chooses not to take the dollars, then localities have the opportunity to apply for those dollars from the feds. I don't anticipate Maryland will choose not to go after the dollars, but there may be some states who choose not to, right? In which case the bill allows for localities to go after some of those dollars. The reality is we're not the regulators, so the big piece here is making sure that the state regulatory pieces get that we work very closely with the state to make sure that none of the regulatory pieces get in the way of our providers being able to get the resources that they need. And so to that end, we've been really looking at the blueprint, Build Back Better, and our current work to make sure that there aren't any contradictions there that could get in the way in terms of providers being able to access this funding. So in terms of what we need to do to be prepared, we need to make sure that we have the best alignment possible between what's on the blueprint for pre-K in terms of the next 4 years as it builds up, what's in the Build Back Better for pre-K and childcare, and then what we currently are doing with our pre-K programs. I know Michelle and I and the team have been talking a lot about the existing 9 pre-K programs, community-based, that are funded through the school system. How do we better align those and make sure that they know which resources to access for the next 3 or 4 years, because they'll have a choice of doing the pre-K, the current pre-K funding, or move to the Build Back Better. And so all of that is all about alignment. And what the Early Childhood Initiative has done is work for the last 3 years around alignment. As you well know, that was one of the big pieces of this piece of work, was to align the school system, the higher ed, et cetera, to make sure that we are prepared. We didn't know we were being prepared for Build Back Better, but we certainly hope. And so, and we, for example, I think all of you may have received already a copy of the study that we commissioned with Adele Robinson to look at the blueprint and the alignment of the blueprint. And so some of the issues there that she raises, one of the biggest ones, and I want to highlight that, is the fact that if we don't do this correctly with the state and with our local work, we run the risk of losing a lot of our infant toddler slots and so seats. And so part of the emphasis on moving to expansion with family child care is that family child care is the preference for many families for infants and toddlers. And it is a place where we can protect infant toddler spaces much more, seats much more than in center-based. So there's a lot of those moving parts. The couple of things that we've got in line, as you saw in the report, one of which is the supply and demand study, is going to be really critical for us in terms of being able to make sure that resources are in the right places. The second is, I think it was mentioned that we were selected by Homegrown, which is a national organization funded by philanthropy, to look at family child care and friends and family, friends, and neighbors. We will be positioned with a plan already at the end of this work that Jennifer is leading. So that when these dollars come down the pipe, we are ready for investments in family child care and family, friends, and neighbors. So great. I think all this work that we've been doing has been preparing us. I do think that it's going to be a lot on the state and what the state decides to do and how they do it and how they work with the feds around the Build Back Better dollars. But
appreciate that.
Anyway, that's my 2 cents on this.
No, thank you. I know, Bibi, you could be here all day and you could talk. You could give us a whole lesson. But really appreciate your work, past, present, future, and that was helpful. I think I wanted to just frame that because the alignment work that we have been doing is going to put us in a good position. Obviously, it's the largest jurisdiction in the state. there's this symbiotic relationship between us and what the state does, and we want to be making sure that we're communicating with them, as I know we are. So really good to hear. When you mentioned Adele Robinson, I remember I worked with her a lot when she was at the National Association for the Education of Young Children when I was on the Hill, and she's been, I'm so glad we've been able to leverage her resources and expertise. So great to hear, and I know we'll have a further session, Ms. Yao, on that once that becomes more real, and really excited to move forward. One just very specific question, then I'll pass it on to colleagues. The race and ethnicity data for the children that we're serving, I know we have it. I'm assuming we have it. I just don't see it. We didn't obviously talk about it in this context. How are we tracking that as far as our, and then the students in Montgomery College as well, and just looking at that and making sure that that's in line with our equity goals and framework? I'm sure it is. I just wanted to allow someone to speak to that.
Is your question in terms of childcare or in terms of the school system or general?
Well, it could be, I guess you're right. It could be the different systems. So for the expansion, we just looked at the presentation. We talked about the expansion. Can we just talk about, why we made the decisions of where we expanded and who that impacted? And yeah.
I believe I'm sorry, go ahead. Go ahead.
I'm ask if Jennifer could pop up and talk to us a little bit about the data around race and ethnicity in the system, and maybe that'll get us started. I think she's here. Jennifer.
Apologies. Okay, can you hear me? I'm having a little problems there.
Yes.
Yes.
Okay. Right. Good morning, everyone. So in terms of race and ethnicity, in terms of our recruitment of family childcare. So
yes, let's start there. Yes.
Okay. So we have been very intentional in targeting specific areas of the county. There are 5 identified zip codes that we have been really trying to work with those who are currently on the ground actually offering family childcare. They're the ones who identify those who may be interested in obtaining a registration. We've been working with our partners with Linkages to Learning and CASA of Maryland, Identity, to spread the word about what it is that we are doing to assist individuals in becoming family childcare providers. We also have staff that are bilingual, Spanish and English, as it is the most predominant language that is seen in many of these jurisdictions. We also have tapped into the zip codes that are identified around Linkages to Learning, so those catchment areas. And again, moving into those areas, using individuals in the neighborhood as what we call our ambassadors to really help spread the word. So informing in home languages, translating when possible, conducting information. And then I think the other part of it is really having a one-on-one relationship with community members, having them know us, build the trust. That's how we find that we are able then to pass communication. So by being able to provide resources in these different languages, it helps build that trust. And so then people will start coming to us and we'll have this back and forth communication in recruitment. Our efforts then, once they become registered, is to put them on a professional pathway, whether that is obtaining Maryland credential or anywhere to the spectrum to higher ed, referring them to Montgomery College. So that's really, it's by using individuals who speak the same language, translation, and being in the neighborhoods.
Great. And then on the MCPS side, I'm assuming since most of these are focused in on Title I schools, you all are tracking that, and it's obviously representative, I'm assuming, of those populations at those schools, the children that you're serving on the
Yes, that's correct. We have made sure that we engage our families early on in the registration process. And so our registration process begins in March of each year to ensure that we have students from within their communities going to our programs. And as you said, we are, many of our programs are housed in Title I catchment areas. And even those who are not in Title I catchment areas are in what we call our focus school catchment areas, which means they're just below the target, the Title I cutoff. So we are engaging a very diverse group. Additionally, we have multilingual family service workers who support our students to make sure that they have access and to reach out to the families, again, to make sure that they have the appropriate resources. And we also have race and ethnicity data, if that's something that you want us to provide.
Yeah, we can follow up with that on the committee. I think I appreciate it. I knew you were tracking it. Just wanted to bring it up. Really appreciate all the work you're doing. Excited about what we've done so far and the ability to even go even further going forward with the things we have coming down the pike. So thank you, Mr. Chairman.
Thank you very much, Councilman.
Council member, just one quick observation, just that as a reminder, folks, that we do not ask for race and ethnicity data for part of our enrollment, as per our executive order from several years ago around race and ethnicity back in the previous federal administration, and that was a challenge for folks. But we do, based on the things you've just heard, we can pull the data out as a secondary analysis as we go forward based on the kind of targeting that we're doing and the information that we're seeing.
Okay.
And just real quick on the, you saw a slide on communication that was really intentional in terms of making sure we were getting to communities that better information out to communities on WPA and making sure that we're getting the utilization on WPA that we want to see in communities that may not be reaching out, especially as Joanne Barnes has said, which is expanding our WPA eligibility to those children who may not previously had qualified for WPA. So the communication strategy built into this was specifically to make sure that we're getting a greater uptake of children in WPA.
And Council Jawando.
Yes.
So for Montgomery College, we actually do track it. The majority are older, non-traditional women. We do have 4 males. I can actually tell you that. 3 of them are males of color in early childhood education. The tracking is critical. We wanted to ensure that we were diverse, but we also have a very diverse, I think our college, Montgomery College is actually used as a model statewide and is now being used nationally for early childhood education. And we track all our students, but also our faculty are very diverse with the languages. We also support them. That's why it was critical to bring them in if they don't test into English 101, that we pull in that ESL, because many in our community, many of our students, childcare providers don't begin on the credit side. And so we have been tracking that. There is data on it. We provided it in the spring, but the majority, again, are non-traditional women, older women, many immigrants. And so that is critical. That is our community and who we serve. And so having faculty that actually speak all the languages, English, Chinese, and then we have our community engagement with Amharic has been very important to the progress and to the completion rates that we now have.
Thank you. I'm so glad you chimed in with that point. So critical. Thank you. Thank you, Mr. Chairman.
Thank you very much. Let me turn to Councilmember Navarro.
Thank you, Mr. Chairman. This is such a wonderful briefing right before Thanksgiving, because it is literally, it's like the stars completely aligned, and every single best practice that we have been discussing for so long is now being implemented, and it's just music to my ears. So I'm just filled with gratitude because this is awesome. And it is positioning us to be ready for this money that is coming. It's funny because I kept thinking, you know, we've had these discussions in the past, and part of what motivated me to push this forward was this notion that we have to be ready in the event of a dedicated funding stream that we all kept talking about, you know, but weren't sure where that was going to come from. But lo and behold, with this new administration at the federal level, thank God that this particular policy area is of such importance. And I know Dr. Jill Biden has always put this front and center. So we are so fortunate to be ready for what is coming. And then to hear every single person that has presented, you know, from Dr. Hernandez to Ms. Vivi Otero to Michelle Owens in the school system, Ms. Joanne Barnes, Ms. Rubin, everybody has literally articulated a best practice approach to this very challenging issue. And it is rooted in equity. But most importantly, it is rooted in our understanding that if we're able to get this right, think of all the extraordinary things that will happen. Our children will enter school ready to learn, which means that we don't have to remediate as much as we are remediating. That is critical because it also speaks to fiscal sustainability, right? Because instead of spending all this money on remediation and ESOL and all these types of things, our children are entering ready and they're entering to be able to fulfill their whole potential, their full potential. It means that parents can go to work and don't have to be thinking about what do I do? Do I pay for childcare? Do I pay for some other very important bill that I have and therefore maybe I can't afford quality? I mean, it just touches up on so many things that I'm just blown away. And again, so grateful because this is extraordinary. A couple of the things I just wanted to say, the piece around workforce is really important. So if we could get a follow-up on the demographic breakdown of the workforce, as Dr. Hernandez was saying, and it is just true. Like I said, I've been having conversations with some of the providers, and many tend to be older, right? And their worry is, I'm an older person, I'm an immigrant, but now I'm required to, get all these credentials and do all these things. Am I going to be able to do it? Am I going to be able to afford it? And how do we strike that balance? And I kept saying, I know it's a balance because we need to have quality. That's important to us. But then we have to be realistic in terms of who is the workforce. And we don't want to somehow position ourselves in a space where we don't have the workforce necessary to respond to this extraordinary need. So how we incentivize and how we meet folks where they are to provide them, that path is going to be super important. I know Montgomery College is doing an extraordinary job, but it is, it's in the minds of a lot of these providers. I think that's going to be really critical. But then also just very quickly in terms of MCPS, I was intrigued by the two-way immersion class, pre-K class in Washington Grove Elementary School, something that we have talked about for a very long time. I'm a huge proponent of dual immersion and dual language because again, it particularly helps a lot of those young students, kindergartners that enter school and they're US born, but they get put into ESOL because they have not been in quality early care and education. So language development has not necessarily occurred. And then they get in ESOL and they stay there. So to me, the whole issue of dual language is so awesome because then language is an asset and you can see the difference. And so I was curious to see how, number one, how that is working and whether there are plans to expand dual two-way immersion types of classes in the pre-K space.
So right now we do have, I believe, 4 Title I schools that have some type of two-way immersion or dual language program. The expansion has occurred at Washington Grove because there was interest in not stopping at kindergarten, but continuing to pre-K so that those students would remain in the articulation pattern. We can check on that, what it looks like in the other two-way or dual immersion, dual language, classes at our other 3 schools.
And those other ones are pre-K as well, or are you saying that it's just Washington Grove, that it's pre-K?
Let me check with Verna. Hold on one second.
So Washington Grove is the only one that has pre-K. There were pilots.
I'm not sure if you can hear her, but she said.
Yeah, I did. I would, I know my colleagues probably would be very interested too, but I would be very interested to see whether you guys can look into expanding specifically for pre-K. That would be so extraordinary. Again, we all know that there are these long waiting lists for things like Spanish immersion program and Chinese immersion, et cetera. So we know that it's something that, helps both children who are limited English, but also those children who want to become bilingual. And it would just be awesome. Same question in terms of full day conversion for our Head Start classes and things like that. I know this council has been very proactive in providing funds for full day conversions, and wondering also if this has been discussed from the MCPS perspective to continue on that route. Is it part of the budget discussions coming up?
Yes, at least from what I've seen so far, I do have to let everyone know that I am new, so I am being very cautious with my responses. But based on what I have heard, yes, there is a continued expansion, in particular as we bring on Title I schools. Their Head Start classes automatically become full day using some of the funding. And we're also looking at our programming for next year in those non-Title I spaces.
And I can just jump in to say, because Michelle's doing a great job. We're happy to have her, and we're lucky to get her when Deanne moved on to MSD. So we are very much committed to that. We're excited about our the Kerwin grant coordinator that we were able to pick up in MCPS, and we have a series of our meetings that are scheduled, and we've already talked. You see how we presented the data on how we have converted some of those half day to full day, and we are committed to expand that in our budget going forward. So that is a yes.
Nice, that's wonderful. The 113 family childcare homes that have been licensed, so that has just been since the inception of the initiative? Is that what that number reflects?
Correct.
That is really awesome. That is really amazing.
Yes.
I really thank you, Jennifer. That's really incredible. And also hearing about the 8 community-based partners with MCPS. And you know, I hope that we also can expand that, because that was that hub model that I've been talking about forever. So critical for us, given that family childcare is going to play, I think, a significant role in all of this. I've always said that, but it's definitely, we've seen it, especially now with the pandemic. So nice to hear Dr. Kroll say that the state is looking at our family childcare model and how we're going to expand that as well, because it is absolutely critical. And obviously, you all know my history with family childcare, and always believe that this is an incredible way for us to expand the availability of quality and affordable childcare. So I just applaud you again for everything you're doing. It is coherent, it's aligned, it is scalable, and to me, that's going to be the great thing, is that once we are able to tap into the money that is coming from the federal government, from Building Back Better, et cetera, that's going to be the moment to scale up. And hopefully then, you know, that conversation I had in the back of seat of that cab with that lady that was saying, you know, see, because of small organizations like Centro Familias, well, we don't have a scaled up national model because you guys are taking care of like small numbers. Well, I can turn around and say, see, we did it. We actually did get to that scalability place where we can then begin to evaluate the impact as children enter school and track that. I think we need to track and see those longitudinal studies to see how we're doing here in Montgomery County. So thank you so much. I applaud you. And again, very grateful for everything that you have done.
Well, thank you very much, Councilmember Navarro. And let me say that for me, same as we've challenged HHS with Dr. Kroll, you'll hear this and recognize this. We want you to think bold and be aggressive. So again, when my remarks came before, and it was more of a comment than a question, you've heard my colleagues also continue to say they want to see that expansion. They want to see us continue to grow. We've got money that's behind us. We're in a rare situation here. I mean, coming out of economic challenges that many across this country are experiencing, Montgomery County has actually found itself in a pretty good position. And that is one in which we should not take for granted, nor should we rest on our laurels. We've got to push forward. And I know it's hard. It is not easy, but it's certainly one, and it's going to stretch folks thin. But we have an opportunity to really accelerate the amount of progress that we can make when it comes to these initiatives. And you heard from Councilmember Navarro exactly what's at stake in terms of the advancement of really getting ahead of some of these issues that have plagued us as a community for a very long time. And now is the time. Now is the time to do this. It just makes complete sense. So I want to turn to my co-chair, a person who knows all too well about seizing opportunity of great moments and being able to really push us forward in some great and innovative thinking. So Chair Alvaro Knopes.
Thanks. That's actually was a perfect segue. Thank you, Chairman Rice. I did not tell you what I was going to be asking about, but it falls in line with that comment. First, phenomenal presentation. The fact that we've been able to expand, achieve all our benchmarks, and that almost half of the locations are directly in the catchment areas that we had targeted initially really speaks volumes to the coordinated outreach, which has clearly been very effective and is going to really impact the quality of life of these kids, these families, and help our community as a whole in every way imaginable. I remember about 8 years ago, there was an assessment and evaluation of the assets, the building locations that we had in the county to see whether we could expand in certain county-owned buildings or county-leased buildings. And we looked at recreation department facilities, and it unfortunately was cost prohibitive at the time. And as we learned through the COMAR regulations, it would have wiped out the use of those spaces within recreation facilities for anything but early childhood and education. And so it would have displaced seniors. But that was 8 years ago. And I think there's clearly is an opportunity for us to conduct a full-scale evaluation of our current assets and county buildings. I heard the county executive recently actually speak about the consolidation of government functions. And now by way of teleworking, we're actually letting go, which is a good thing, of a lot of the lease space that the county had in properties. And as we know, properties right now are really struggling to meet. There's a lot of unoccupied office space around the county. And so I wonder if moving forward as part of this plan, if it isn't already there, I think it'd be worth conducting another assessment and evaluation of county-owned property that we manage and control as we enter into the next phase of this work. And I don't know who's in the best position to be able to respond to that, but I know the Department of General Services led that effort before because they had the best handle on what was out there. But I think that, done in collaboration with MCPS and the college, could be really effective in shaking loose some other options that are out there that may not have existed prior to the pandemic.
So, Councilman Hernandez, I can't speak to what General Services is doing in the moment, but I can tell you that review and look at what we're going to do with the future of county controlled spaces is very much on the front burner for General Services and for the county executive. So I will be happy to take this back and add this to the list of things that we need to consider and ask the team to think about how we collaborate with the colleges and with the school system around any opportunities that present themselves, especially in high need areas. Because I think that is still that will always be a driving consideration.
So, Council Member, we've had several conversations around supply, and within the steering committee. And one of the things that will come out of the supply and demand study is where is that supply needed in regards to future need and expansion. And so a follow-up to that is absolutely an analysis of property and facilities that are maybe available. So that the sequence of this is really to look at the supply and demand study and to make sure that we then identify places where you have a real need to expand, and to really look at then how do we then help providers. This is all a private-based system, right? These are all private providers. And so their ability to expand, their financial capability, all of those kinds of things come into play. We do not have county-run childcare, as you well know. And so it's complex in terms of making sure that we align supply needs to locations and then to providers who have the capability and the ability to expand, and then the financial mechanisms to make sure that those expansions are possible. So that's sort of the sequence of looking at how this plays out. But it's definitely, as Raymond said, been part of our conversation in terms of if we don't grow, to your point, if we don't grow the supply, then we run the risk of pushing out our lowest income children. In particular, as you look at Build Back Better and the blueprint that begin to expand eligibility to 400% of poverty and even beyond. Then if we don't expand supply, you run the risk of losing your poorest children and providing care to even within the eligibility to higher income. So that's a real critical balance that we're looking at, and we want to continue to make sure we pay attention to.
I appreciate that, and in that regard, I'm channeling a question from Councilmember Navarro that she's been terrific about making sure it was created as a possibility. But where are we with the park and planning space in Wheaton that is so beautiful and could do so much? What's the status of that?
Back to that. As you know, that is a parks and planning project, but we've been collaborating with them ever since the initiative began. We've been working on helping them to know the educational piece of the and some of the space issues of the RFP. They after having a failed RFP and another meeting with providers is when we jumped in to work with them, and they have they're putting in up to $500,000 now to the build out, and then the initiative is putting in another $500,000 to build out and $250 for startup costs, which might include playground. We had to solve a playground issue, which we solved. And my understanding is they're going through something called a test fit. I don't build buildings, so I don't know what that means. And they're doing that through a couple of different RFPs that they had to do to get the contractors in to do that. And then the intention is for the RFP to go out in early 2022 for the space. That's where it is.
Thank you. That's super helpful.
Yeah, the other details would have to come from them if you want to know more about actually where they are.
Gotcha. Thank you, Dr. Andrews. And just serendipitously, I had a chance to take a tour of the new WorkSource Montgomery space, which happens to be in downtown Wheaton. And they are considering expanding weekend hours for training opportunities. But as we know, one of the barrier issues to participation in training opportunities is finding quality childcare. And I think we could connect two really significant dots once this facility is off the ground, offering the wonderful programs and services Monday through Friday, but with the right provider and maybe meeting them part of the way, maybe be able to create more opportunities. Just one of 1,000 examples that are out there that I think will really move the needle. Just final two thoughts. So one of the things that I know Councilmember Navarro was very intentional about when she helped establish Centro Familia, and Centro Nia does this too, is really the holistic support it provides to families. Obviously, it provides the highest standards of care and education to the children that participate in the programs, but there's a holistic component and sort of a navigator component to connecting families who may be in crisis or may be struggling or may need some additional service. I know HHS has been working on expanding a navigation service because we've had just this better connection of constellation of programs and services through the pandemic that I think really gives us hope coming out of this that we're actually going to be stronger than we were before it. But I would just urge us in the next phase of this discussion, now that we've hit these spectacular benchmarks and are heading in the right direction, on how we can be more intentional about adding as part of the curriculum that holistic service for families as a whole, which I think would be really helpful. And I guess the final component that I'll mention for now is retention has become a huge issue across the board in this space. We're seeing it with our teachers. And so that also is something that I know we've had previous conversations about, but we'll have to enter into this conversation as well, because we've hit these benchmarks, we've added this capacity, which is phenomenal. But we're not out of the woods by any stretch of the imagination in terms of what's before us. So anything from a health and wellness standpoint, helping to encourage career development work in this space, as we've been doing, any and all efforts that help us retain the talented staff that we've been able to recruit is obviously going to be critical moving forward for sustainability. So those are more comments than questions, but thank you so much, Mr. Chair. I yield back to you. It's been a great presentation.
Well, thank you very much, Chair Albornoz. And so I want to try and sum up a lot of what my colleagues have said just by saying, first and foremost, thank you. As we approach Thanksgiving, it's important to be thankful and to appreciate all the work that people have done to make our community a better place, to make lives better for others. That's incredibly important. And I think that we all know and recognize that over these past almost 2 years now that we've dealt with the COVID pandemic, not only have we had to continue to make sure that those that were already struggling weren't sucked under, but that we also found ways to continue to lift people up by doing things differently than we ever have before, right? So we found new methods to continue with this analogy of rescuing people and bringing them to shore. The key is now that we've done this, we need to continue to build on that. We need to continue to bring even more of those people to shore. We don't want to continue to just try and rescue people, right? We want to get them on firm footing, get them on firm, solid ground. And we can do that by doing these initiatives, by making sure that they're fully funded and that they're also fully staffed up, that we have the processes and procedures and the places with which to do them. That means continuing to utilize our school spaces. And so when it comes to South Lake Elementary School and new iteration that's going to be there, and we know an area that needs childcare, that's got to be a key component. We've heard about the strategies there with Watkins Mill and having the firm placement. That needs to be a part of the capital budget. And so I'm assuming that will be a part of, and I haven't looked at it in depth. I know that the school board just passed it 2 days ago, I think it was. But when we look for those kinds of details, those are going to be imperative. Those need to be a part of our core planning now. It's not just a hope, but it needs to be a must. And especially because we have the resources behind it. When I look at the infrastructure bill and what's there, a lot of those funds would be eligible to be utilized for this purpose, right? And I see Vivi nodding her head. She knows she's worked on it. So again, this is what I'm talking about. I mean, this is now, right? This is what we've got to do. And so, again, you've heard from my colleagues, and it represents everyone that's here. And I'm going to turn to Councilmember Glass in a moment, because I think that the communication piece is really important, and being able to make sure that our parents, that folks that are thinking about entering into the space, can make sure that they are able to utilize this. But those that are thinking about actually becoming childcare practitioners have that pathway that's out there for them. And that still needs to be communicated, because I think that we do a good job, but we can do an even better job in making sure that more and more people know about this pathway that's out there and how we're fixing the inequities that have long-standingly existed when it comes to early care and education, and those educators being paid significantly less than their counterparts in K through 12, right? We've fixed that when it comes to the blueprint, and we should start to see that trickle down to those individuals. But the key is that we've got to make sure that that's out there, that people know that, because for far too long, historically, it's been a profession that everyone is deemed lesser pay, more work, harder. And so therefore, of course, we're going to be challenged with not finding the right amount of people that are necessary to meet the need that we're seeing in our community. So with that, let me turn to Councilmember Glass.
There's nothing more that I can really add to the really good conversation, but I'll say that I was a scout in my younger years, and the scouting motto is be prepared. And clearly that is what we've been doing over these years. And my hat's off to all of you, and especially Councilmember Navarro, for planning for this moment, this serendipitous moment that we are in, and that we are going to seize. And so thank you all for these years of planning, and I look forward to what we're going to accomplish together. So I yield back. Thank you very much.
Here. So, it's that positive outlook that I certainly want to close with. I don't see any of my other colleagues who want to add anything else, but it's that positive outlook that Councilmember Glass just said, that we look forward to success. We've seen that since 2019 and the planning and the announcement and actually seeing it actually come to fruition and see great work being done, how much potential is there. And so we know that since we've accomplished this much in just a short 2 years, how much more we can accomplish with even more support, with even more understanding of where we need to go, and financial. And I can't stress enough, because it's always the biggest challenge for us, and Dr. Kroll knows all too well. There are times when money is tight and you wish you could do stuff. Well, that's not the case here. This is a case where we actually have the resources that are there. And so it's a great opportunity for us. So with that, I want to say thank you to everybody on the call. I wish you all a very happy and safe Thanksgiving. Please make sure that you stay safe, but that you enjoy the company and are able to reflect on the blessings that we've had over these 2 years in being able to be here, to be present, to still be healthy, understanding that there's so many in our community who unfortunately were not blessed the same way that we were. So with that, take care, guys. God bless.
Thank you.
Happy Thanksgiving, everybody.
Happy Thanksgiving, guys.
And he would be in there constantly buying reeds.
Founder Victor Litz started the business by giving